Hello everyone, this is Dr. Uma Megeshwari. Today I am going to discuss about modern concept of childcare. This is one of the topic which comes under the pediatric nursing. So first we'll see the introduction. The child health, I mean pediatrics, also spelled pediatric. It means here there is two spellings are available. That is one is the P-E-D-I-A-T-R-I-C. Also it can be spelled P-A-E-D-I-A-T-R-I-C. Both spellings are correct. So here the child health, otherwise a pediatric nurse, has a significant role in the care of child, whether health or sick. It means that everyone thinks, especially students, are thinks that child health nursing means taking care of the children only, especially those who are admitted in the hospital, but it also included the care of the healthy child. For example, we do immunization to the healthy children only. So basically child health nursing is the department that is taking care of the both health and the sick children. Next, pediatric age group, it is from conception up to 18 years. This conception up to 18 years can be varied according to the policies of the government, especially in India. According to the census of India, children age limit is up to 14 years only. But generally when we think about this age group, it can come up to 18 years. So when we divide the 18 years age group into 5 various section, it comes like this: infant birth to 1 year, toddler 1 year to 3 years, preschooler 3 to 6 years, schooler 6 to 12 years, adolescents 12 to 18 years. These adolescents are divided into again 3 groups that we will discuss in another video. Next we will see about meaning of pediatrics. The term pediatrics actually derived from the Greek word. It is having 3 words combined. One is the pedia, second iatric and ex. Pedia means child, iatric means treatment. This treatment includes both surgery and medicine. Ex means branch of science. It means the meaning comes like this: it is the department which is taking care of the children's both medical and surgical problem. Next we will discuss about the definitions. Here we are going to see 3 definitions. First definition about the pediatrics. So what is pediatrics? It is a science and art or dealing with the health of infants, children, adolescents and their growth and development. As we already discussed that it's a science. It is dealing the health of the infants. Infants means birth to 1 year. Children we can count up to 12 years and adolescents, right? So basically we are taking care of the all children up to adolescents and also their growth and development. Regarding growth and development, I will upload another videos, then you can understand very clearly about this. And it also we are taking care of the children, also enhancing their capability to achieve full possible as a good adult in society. So second definition says that it is a branch of medicine dealing with the children up to adolescents. It also include what are they: planned preventive care, curative care and rehabilitative care of children. Okay, prevention in the sense we can tell that we are doing immunization to prevent some kinds of diseases, and when the child is having any health related issues, that we are giving treatment. So they are getting curative, and after the treatment process completed to become a normal, we are also taking care of the children up to the rehabilitative level. Next, pediatric nursing. It is a nursing care given to the infants, toddler, preschooler, schooler and adolescents with more patience and affection by qualified and efficient nurse. So you understood very clearly, I think, that pediatric nursing is the nursing care given to the infants, toddler, preschooler, schooler and adolescents with more patience. Why pediatric nursing need more patience? So for example, when you inform to adult patient that you are going to give injection, definitely they will understand. They will understand and they will cooperate with you. But the same process when you are doing for the children, you need to give more explanation. So for that you need more patience. Okay, and also pediatric nurse should have little more affection towards the patient, to patient in the sense children's. Okay, and also they need special qualified and efficient nurse to taking care of the patients. So it's a nursing care given to the children with more patience and affection by the qualified and efficient nurse. It is also specialized field of practice for registered nurse in the care of children from birth through adolescence. Here it is written that a specialized field of practice. Practice means what? Taking care of the patients in the either ward or community area anywhere. But here specialist field of practice in the sense the nurse, those who are taking care of the children need extraordinary training. So that's why here we are mentioning that a specialized field of practice, and that should be registered nurse only. Okay, and they taking care of the birth through adolescence. Next, pediatric nurse. Pediatric nurse is a specialized nurse. Specialized nurse means the nurse who completed their degree like GNM, ANM, B.Sc. They should have extra training for the pediatric nursing. Okay, so those nurses are called a pediatric nurse. After the basic qualification, they are supposed to undergo the specialized training to taking care of the children in the ward or in a community setting. Okay, so here, so those pediatric nurse, they are having specialized training. They provide empathetic care to the children of all ages from birth to 18 years in variety of settings. Setting means where they are giving treatment. For example, healthcare clinics, hospital, community areas, schools, physician office, anywhere. So basically what they are doing, they are help to prevent diseases, promote health and educate the family members on plans of care. Next, we'll discuss about modern concepts of child care. Actually, this is the main topic I plan to discuss in this video. So first, I would like to explain about what is modern concepts. In olden days, some concepts were available. According to those concepts, child health nurses were taking care of their patients. But those old concepts has been changed now. Now we are having some new concepts. Those concepts are called modern concepts. Okay. The first point is the family-centered care and parental support. By name itself, you might be understand that family-centered care. It means a family has to support in taking care of the children in including hospital or community setup. Okay. So care in the sense what it means that suppose one child is admitted in the hospital, that bathing has to be done. Okay, it is not mandatory that the nurse has to be give bed bath during admission of the patient or child in the hospital. Once the parents are available, they can do their own. In this way, we are reducing the stress of the child. Okay, now I mentioned stress. Sense means you know very well. Okay, so here, when the adult patients are admitted in the hospital means they don't have any stress. They are not getting stress once they admitted in the hospital, because they knows very well some problems are there. After the treatment, definitely they are going back to their home. But the children will not understand. They might be confused that why I'm admitted in the hospital, why some other persons are coming, also they are getting pain. So this and all creates some kinds of stress. Regarding this stress and anxiety, I will discuss one more video. So basically, to avoid stress and anxiety of the children, those who are admitted in the hospital, we are making the parents or any other family members to support in the child care. Next is child centered care. It means the treatment process has to be discussed. If they understand, it should be discussed with the children, and we should give their chance to take the decision also. Also, they have to take care of their own in hospital setup also. According to the need of the child, we have to plan and we have to implement the plan to taking care of the children. So here it involving the children in their care makes them feel less fear by the healthcare professionals, and their self-esteem also promoted. Next concept is the atraumatic care. Okay, here it is that atraumatic care. It means that we need to avoid making trauma to the children, those who are admitted in the hospital. Okay, so how to do this? So before that, I just want to make some ideas of what kind of trauma they are getting in the hospital. For example, once they are admitted in the hospital, they need to go so many medical and surgical procedure routinely. Also, because of the procedure, they will get injury or pain. Okay, also main problem, separation of the child from the family. So these are the some of the very important problem they are facing. If we are avoiding this problem, we can give easily a traumatic care. Okay, that is what I'm telling. So here, how to do a traumatic care? First of all, when the children are undergoing for any medical and surgical procedure, we need to prepare them properly. Once we explain everything to them, they will understand the concept and they will cooperate very well. And also we need to avoid maximum injury. It means that inserting, IV cannula should be in one side, or otherwise that within one prick we need to take blood. So these are the some of the things should be done by the pediatric nurse to avoid unnecessary injury or pain. Also separation of child, that should be managed by how? Only by using family members to taking care of the children in the hospital. Okay, that's about a traumatic care. And children continuous care, CCC, it provides safe and high quality care of the children through process of assessing, make a decision and approving continuous care for children with complex health needs. So here we are explaining that through the continuous care in the sense continuous monitoring of the children and care according to the need of the patients. Okay, here we are providing safe and high quality care and by using the assessing method and taking decision in proper manner in the complex health needs. Next one is a holistic care of children. It means a holistic means a whole child care. It means once the child is admitted in the hospital, we need to take care of their physical health, mental health, emotional, intellectual and social, moral, cultural and spiritual well-being. So that is what here holistic care of children. It means taking care of not only physical, we have to take care of all the aspects like mental, emotional, intellectual, social, moral, cultural and spiritual well-being. Okay, next cultural care. So here we need to talk about cultural care in the sense we supposed to know the patient culture. This is a common for all patients actually. Whenever wherever we plan the treatment for any patients, we need to know their culture. According to that culture only we have to plan. Once if you planned, while planning also we need to involve the patients. Okay, after the planning according to that culture we have to implement the plan. Okay, this is what here. So why cultural practice we need to do? For example, if one patient is anemic or malnourished. Okay, so most probably we will discuss that that protein should be increased, so we'll ask them to take egg. But though and those malnourished patient may be vegetarian, so that patient will not take egg. So if you are advising you take egg, in the sense it definitely against the culture. So we have to understand their culture. According to the culture we need to plan. And also it is very easy to maintain the protein level without egg also. Okay, so this is here we are doing culturally practice, and the service can improve the promote positive outcomes and reduce difference among the children during care. Next one important modern concept is play therapy. Okay, here we mentioned play therapy. Okay, why it is play therapy? Why it is not play activities? Okay, so generally once the child is playing, in their home, that is normal activities. That we can tell play activities. But in the hospital setup, by a specialized person or in specialized method, suppose you are making them to play for the treatment purpose, that is called play therapy. Okay, so what is happening here? Once the child is admitted in the hospital, their routine is getting disturbed, because one play activities is one of the important business of the children. Why it important business means they are having only three activities, especially eating, sleeping and playing. Okay, so this is, so it is, that's why it is the one important business. But that business may be disturbed because of the admission. So what we have to do here, we can ask the parents to bring their own play articles, and we will make the child to play in hospital also from their own play material. Okay, so they will feel that comfortable, and they can also continue their normal life. Next is the increasing emphasis on preventive, promotive, maintenance and restoration of healthcare. Here four concepts are combined. So preventive care means vaccination actually. We are administering so many vaccination to prevent so many diseases. Okay. So here not only vaccination for the preventive purpose, we are giving health education to avoid infections. So many things. So what are the care we are giving under the preventive measures nowadays improved. Okay. And promotive measures, this promotive measures similar to breastfeeding, like for example, to improve the nutritional status of the newborn or any infant, we are asking the mother to continue the breastfeeding even after weaning also, and we are expecting the mother to maintain the proper breastfeeding method. So what are the measures we are making for improve the health of the children comes under the promotive measures. Next is the health maintenance. Once a promotion has been done, that has to be maintained regularly. Okay, so here health maintenance refers to the health care of the children who are essentially well and the chances to have some risk condition. So generally children are comes under the vulnerable group. Okay, so we need to maintain their health regular manner so they can achieve their health properly. The fourth one, last one is the restoration of healthcare. Suppose one children are getting ill, so we have to take all the measures to bringing them to the health. So we can tell that ill children whose condition deviate from the positive health has to be taken care of the by the pediatric nurse. So these all are modern concept. Thank you so much listening me patiently. Please, if you have any doubt, contact me. Thank you.